Looking into today's Austin health news, an estimated 6 million people in this country are diagnosed with scoliosis or a curvature of the spine. The good news is a new center right here in Austin can help you find the right treatment for the disorder. Here to talk about that is orthopedic spine surgeon Dr. Matt Geck, the co-chief of the new Seton Spine and Scoliosis Center. Good morning. Thanks for joining us.
Yeah, thanks for having me.
So we were just talking about the fact that even though we all get checked when we're little kids in school for the curved spine, millions of people still end up with scoliosis.
Yes, and it becomes an issue really for kids and adults. For kids, usually that school screen does pick up some kind of scoliosis, but sometimes it doesn't. And for kids, it can be an issue with progressive curves, and when those curves get very big, it can affect organ function. But usually we're treating kids to try to prevent the consequences of scoliosis for adults, which is big spinal deformities, bad backs, pain, and in kids they bounce back very quickly from these surgeries.
So, okay, so kids, when you do check the spine, if you do see that there is a curve in the spine, do they have to wear a back brace then to fix it? Or are they it's still forming so you can fix it without surgery, or do they also require surgery?
Right. I mean, right now, if we can catch scoliosis when a kid is skeletally immature, then we can brace it out and about 2/3 of the time prevent them from ever needing surgery.
Okay. So, but obviously that's why you want to catch it as early as possible. So now let's talk about adults, because for some reason I had always kind of thought, well, you check when you're young because when you're an adult it's just almost irreversible. But that's not true, right? Like there's surgery that's become a lot better, more efficient, and more effective, right? That can work for this. Tell us a little bit about that.
Well, sure. For adults, there's really two kinds of adults. There's the young adult, the 20 or 30-year-old whose curve was, they were told their curve probably won't progress.
Right.
But we know now that's just not true. These curves can progress, produce spinal deformity issues, and also, become a problem for your back, cause back pain, cause disability. And the things that we're doing now with surgery, surgeries that were once big affairs, 12 hours front and back, are now more like the pediatric scoliosis surgeries, single approach, 5 hours, and we can get fantastic corrections of big scoliosis curves. We don't need bone graft anymore. And one of the focuses of the center, sort of our next step, is to try to take now minimally invasive techniques. So the things that we do, these little discectomies, trying to take that and move it to scoliosis surgery.
Wonderful. So it doesn't have to be such a big production. We were just looking at a couple of pictures, and I'm assuming that was showing a curved spine and what it really looks like. So if people are experiencing back pain, and you could probably just feel back there and notice, well, my spine doesn't feel totally straight, you recommend, no matter what age, just to come in and get checked out and see what options there are?
Yeah, absolutely. Our big focus for any spine problem is treating people conservatively first. And if we can get folks in early, often conservative treatments are all they'll need.
Okay, all right, a lot of good information. Thank you so much. And I know people can go check out the new center and get all of their questions answered and get some expert help so you don't have to live with pain. That's wonderful. Appreciate that.